right, guys, we are going to move on to uterine abnormalities. Now, the first one we're going to talk about is adenomyosis. Adenomyosis is the abnormal implantation of endometrial glands inside of the myometrium. So you're going to have endometrial glands inside the myometrium. When does this happen? Usually between 35 and 50 years old. And what happens? They have pain, okay? Pain and dyspareunia. So between 35 to 50, pain, menorrhagia, dyspareunia. What are going to be your risk factors? Your risk factors are actually endometriosis and fibroids. Now, how do you make this diagnosis? Well, this diagnosis is actually clinical. So it's a clinical diagnosis, and what are you going to feel? When you do your bimanual exam, you're going to feel a round, heavy, globular-like uterus, right? That alone is going to be enough to indicate that this is adenomyosis. So it's a clinical diagnosis, okay? Round, globular uterus. What is the most accurate way to diagnose this? MRI. Accurate is going to be your MRI. What is your treatment? Unfortunately, the only treatment for adenomyosis is a hysterectomy. If the woman is has passed her childbearing years, you can do a hysterectomy. Now, endometriosis. Now, endometriosis and adenomyosis sometimes get confused. Why? Because they both have, abnormal implantation of things in abnormal places. However, adenomyosis is endometrial glands within the myometrium. However, endometriosis is endometrial tissue outside of the endometrial cavity. So, endometriosis has abnormal endometrial glands outside of the cavity. All right, so what does this cause? This causes pain, all right? Causes pain, infertility, all right? Now, this pain actually occurs 1 to 2 weeks before menstruation, all right? And it resolves with menstruation, all right? So your pain occurs 1 to 2 weeks before. Worst time is 1 to 2 days before menstruation. And it relieves with menstruation, okay? It is worse, your risk factor, it's worse if you had a first-degree relative with this. All right. Now, diagnosis. Your diagnosis here is going to be on laparoscopy. You are going to do laparoscopy. When you do a laparoscopy and you do surgery, you are going to see things like that chocolate cyst, which is endometrius on the ovary. You're going to see blood in places it shouldn't be. Okay, so you're going to see these endometrial glands in a bunch of different places where it shouldn't be. That is going to be your diagnostic test. Now, how do you treat this? Well, you can use NSAIDs for pain, okay? You can use NSAIDs for pain. You can use OCPs to help control it by decreasing ovulation. You can use medications like danazol. What's danazol? Danazol is an androgen, okay? Androgen analog, okay? So that causes acne, oily skin, weight gain. And then we have Lupron. What's Lupron? Lupron is a GnRH. Okay? GnRH agonist. Both of these aim to decrease the LH and FSH. Okay? However, if the patient is infertile, this laparoscopy, that's not only going to be diagnostic, but it's also going to be your treatment. Why? Because they're going to clean out all of those endometrial glands all over the place, okay? Once they clean them out, that actually reinstates the person's fertility, and that can also, that can help, all right? Lastly, these two things are important. One of them is going to be fibroids. Now, fibroids, you hear a lot about them, okay? Why? Because they're very, very common. Now, fibroids are a benign tumor, okay, within the myometrium. So they're benign. They can be inside, they can be a bunch of places, okay? So if this is the uterus, you can have them on the serosa, you can have them in the myometrium, or you can have them in the endometrial cavity, all right? You can have them pretty much anywhere. Now, they are benign, but they cause pain, and they cause metorrhagia, okay? Your diagnostic test is going to be an ultrasound. You're going to see them, all right? And then your treatment of choice, you can give OCPs to help decrease the bleeding and the pain. But if they are large, all right, you can, and they're done with childbearing age, you're going to do a hysterectomy. You can do a uterine artery ablation. Remember I told you where they basically clot off the uterine arteries? So uterine artery ablation. Or they can do, if they want to preserve fertility, they can do a myomectomy. Basically what that means is they cut open the uterus, they remove the fibroid, they shut it. Now remember, that is a risk for, once you're pregnant, for uterine rupture, okay? Lastly, I only want to say one thing about endometrial cancer. Endometrial cancer, endometrial cancer is found in postmenopausal women, all right, who suddenly have bleeding. So they're postmenopausal, they have bleeding. Now you must do a biopsy, okay? That is the only thing that you'll be asked. Endometrial cancer is postmenopausal women with bleeding, and that equals cancer until proven otherwise. You must do a biopsy first, okay? So do a biopsy first in your postmenopausal bleeding women, all right? That's pretty much the only thing that they'll ask you on endometrial carcinoma. All right, guys, so as for your uterine abnormalities, you have adenomyosis and endometrial glands inside the myometrium. You're going to have a heavy, boggy, globular-like uterus. The only real treatment is a hysterectomy. It's a clinical diagnosis, but the most accurate test is MRI. Endometriosis. This is endometrial glands outside the cavity, the endometrial cavity. It's mostly on the ovaries and the pelvic peritoneum. Now, this causes infertility. It's a very common cause of infertility. Your risk factors is going to be a first-degree relative with it. Diagnosis is going to be found in laparoscopic evaluation. If the patient is infertile, this is also going to be your treatment because they're going to clean out all of the endometriomas. Fibroids are benign growths that cause pain and heavy bleeding. Diagnose it with ultrasound. You can remove them or just treat them with OCPs. One last thing about this, when you have these and you're pregnant, right, sometimes you get pain because the blood supply is no longer there for them. They actually degenerate. So that's something to know about pregnancy. Last thing, endometrial cancer, must do a biopsy on postmenopausal women. I'll see you in the next chapter.